A very good afternoon to everyone. This is Dr. Apoorva Srivastava and I belong to Faculty of Paramedical Sciences from Physiotherapy Department, and today I am here to give you a video lecture on spinal cord injury. Before starting with spinal cord injury in specific, we will look at the salient points which we will be discussing in this lecture. Firstly, we will discuss about the anatomy of spinal cord, then the definition about what spinal cord injury means and what is its particular definition in general. Then the etiology as in the causes which cause this disease, spinal cord injury, the epidemiology especially in Indian population, the diagnosis through which we can confirm that yes, a person is suffering from spinal cord injury, the classifications of whether how many types and how many distinctive characteristics are observed in a person with spinal cord injury, and then a detailed physiotherapeutic assessment. So when we look in general, if we look at the anatomy, the central nervous system in general is divided into two parts, brain and the spinal cord. Brain forms the CPU. Brain is the CPU of the body. It forms the basic processing unit of the body. So all the intellectual and cognitive abilities are governed by this structure called brain. Spinal cord, as we can see, spinal cord is a very delicate and a very intuitive organ which basically performs the transformation and translation functions. Translation of the stimulus, translation of the various reflexes, and translation of the messages from the brain to the effector organ. So when we'll study spinal cord in specific will conclude that the structure of a normal spinal cord, TS section of a spinal cord, involves the anatomical structure. When we see the anatomical structure in detail, we can see that there is a very prominent dorsal column and ventral column. Now, when we are studying about the anatomy of spinal cord, we can see that there are two distinctive regions in a spinal cord, in a TS section of spinal cord. This is a TS section where we can see the spinal canal. The spinal cord, which is a delicate organ, is enclosed within the spinal canal, and the surrounding structures conclude the ventral horn and the dorsal horns. Now, these dorsal and ventral horns are very specific when it comes to their functions. Basically, the function of touch, pressure and vibration are governed through this dorsal column or dorsal column of the spinal cord. And there are two structures present at this end. This is called the spinothalamic tract, the ST tract, and this is called the corticospinal tract. When we will study about the various classification and differentiations of the spinal cord, then these terminologies like touch, pressure, vibration, dorsal column, ventral column, corticospinal tract and spinothalamic tract will come into disintegration and differentiation. We will study about that corticospinal tract is responsible for the motor pathways responsible in our body, and similarly the spinothalamic tract is responsible for differentiation of pain, temperature in our body. So, looking at the anatomy, we can see that the spinal column is very prominent over here and through which the spinal cord passes. Now, this spinal cord can be divided into extramedullary and intramedullary regions. Extramedullary regions are basically outside the medulla. Outside the medulla occurs through this region, and intramedullary regions occur through this area, into this area. Any tumor or any sort of region which is considered in outer part of the disc is considered as extradural. That is, this depends on the dura mater, the presence of dura mater, or the presence of region above and below the dura mater. So, this is a detailed anatomical structure. Now, coming back, we will study about the definition of what is a spinal cord injury. In spinal cord injury, according to WHO, World Health Organization, spinal cord injury is a dreadful disease which is caused due to any injury or damage to the spinal column. Spinal column basically which performs various functions of the nervous system, forms the spinal nerves, performs the function of translation of messages from the brain to the effector organ, and various other functions of the central nervous system. Now, this spinal cord which serves as so many functions, if this spinal cord gets cut in between or there is a tethering in between, this is called spinal cord damage or injury to spinal cord. Any injury or damage to the spinal cord which causes loss of motor functions, loss of sensory functions, autonomic reflexia, urinary bladder retention, and various other symptoms, it is called spinal cord injury. According to WHO, most major of the neurological cases seen in any dreadful condition or in any epidemiology is basically of the cord injuries. Basically, according to WHO, in India, approximately 2 to 3% of neurological cases constitute of this spinal cord injury in detail. Spinal cord injury could be of many types. So, these 4% cases could be of various types which we will be discussing henceforward. So, if I talk about the definition, the proper definition of spinal cord injury is, it is any damage to the spinal cord or any trauma to the spinal cord which causes loss of motor, loss of sensory, autonomic dysreflexia, bladder and bowel syndromes, urinary retention, etc. These symptoms constitute a proper particular spinal cord injury in general. Now, coming back to the third point, which is etiology. Etiology or the causes. Etiology basically is given through an acronym which I have made, which could be understood as FSISGS. This is the acronym for various etiologies which cause spinal cord injury. This F stands for fracture of the vertebrae. Since we studied earlier in anatomical structures that the spinal cord is surrounded by the spinal canal and the vertebra is the bony structure in which the spinal cord is enclosed. So, any fracture or any dislocation fracture of the vertebra can cause spinal cord injury or any compression at the level of spinal cord. This could be, may or may not be associated with dislocation. Any fracture of the vertebra, any fracture of the vertebral column could or could not be associated with dislocation of the vertebra. Whether there is dislocation or not, there are high chances of the spinal cord to get compressed or to get hampered. The second is sports injuries. Very prevalent in various sports injuries. As we talk about concussion or we talk about any sport injuries like boxing, badminton, any sort of injury which forces a specific compressive and shear force over the vertebral column or the spinal column can cause spinal cord injury. Very, very prevalent in cases of whiplash in form of whiplash injuries, as caused in cases of concussion or in cases of any rugby or football matches. Next, I. This I stands for infective cases. Infective cases, it could be traumatic. After trauma, after any sort of trauma or any sort of injury, the infective cases can lead to spinal cord injury. This infective may also include industrial industrial accidents. Industrial accidents, as in there are many workers, we have seen in clinical practice that there are many workers which undergo spinal cord injury after any industrial accident or after undergoing any accident within the machinery or due to some heavy machineries which exert a very compressive and contractile force at the spinal cord and vertebral level. The next S stands for, this G is for gunshot wounds. Gunshot wounds, as in general, this describes that people who deal with bullets or guns, or if there is any firing of bullet very close or near to the spinal cord canal, it could cause spinal cord injury, whether complete or incomplete. This S stands for stab injuries. Stab injuries, as in there are various forms of injuries where there is sharp stabbing feature at the level of spinal cord. It could occur as a result of trauma, accident, car accident, or any sort of injuries from knife, etc. The last S, which stands for surgical trauma. Surgical trauma, as in general, when there are various surgeries that are planned for spondylolisthesis, anterolisthesis, and PIVD at the level of extrusion. There are various surgeries which are planned at the level of vertebra to distract them from each other, and in general to bring back the IVD, that is intervertebral disc, to its normal space. That is why some surgical incisions or some surgeries may land up producing spinal cord injury to patients. Now, if we look at the etiology, we have studied FSI, SGS. F stands for fracture, again S stands for sports injuries, I stands for infective or industrial accidents, S stands for stab injuries, G stands for gunshot wounds, and S stands for surgical trauma. Now, if we look at this, we are forgetting a very common factor which could be seen in most of the cases, and that is fall. Approximately 30% of the cases of spinal cord injury which we see in our daily practice, in our clinical practice, occur due to fall from a very specific height, due to which the compression of vertebral column occurs, which causes a very sharp and very tethering form of force at the spinal cord level. Now, coming to the fourth point, which is epidemiology. Epidemiology, basically in India, 2 to 4% of cases of hospitalization and surgical cases occur due to spinal cord injury in one form or the other. Next, it occurs generally in cases in patients who are between the age of 20 to 40 years. Males are more affected because males generally are more towards the economical and financial resource earning. So, basically industrial tie-ups, surgical and sports injuries include more involvement of male. That is why there is high prevalence of males getting spinal cord injury, suffering from spinal cord injury as compared to females. Then as I told you, fall is a very basic and very important component if we study about the etiology of spinal cord injury. Now, the fourth point which comes to our mind will be diagnosis. Diagnosis, how will we diagnose a spinal cord injury patient, or how do doctors diagnose that a patient is suffering from spinal cord injury, especially after the history taking, after understanding the chief complaint of the patient in general. But if we want to make a specific diagnosis regarding spinal cord injury, we could say that there are two very reliable sources, which first being NCV and the second being a diagnostic scale called ASIA. Now, if we study NCV and ASIA in specific, the diagnosis will say that one depends on the nervous tissue, the nervous supply, and the contactness of the intact and contact forces of the nervous tissue towards one another, which involves the principles in nerve conduction velocity test. The other is the ASIA scale. ASIA scale basically is an American tool which they use to classify the categories and the degree of spinal cord injury. The first is NCV, nerve conduction velocity test. In this test, basically stimulus is referred to patients through electrochemical series, electrical signals, and the electrical signals occurring within the nervous tissue give us the complement that whether the nervous tissue is intact or not, or whether there is any form of injury, damage, trauma, or any sort of discontinuation occurring within the nervous tissue. The second form of diagnosis is ASIA scale. ASIA scale basically stands for American Spinal Cord Injury Association scale. This scale was formed by the Americans to diagnose about the various levels of spinal cord injury. As being a physiotherapist, we cannot deal with a particular form of spinal cord injury. We cannot render physiotherapy management, a particular physiotherapy management for different levels of ASIA or for different levels of spinal cord injury. This ASIA scale basically divides the spinal cord injury level into 5 types: A, B, C, D and E. A stands for complete spinal cord injury. If any patient after assessment reveals that it belongs to ASIA scale A, it means that there is complete spinal cord injury. This complete spinal cord injury basically involving S4 and S5 segments as well. Next, category B. B level of ASIA scale represents that there is incomplete type of spinal cord injury where sensory function is preserved. While studying about the nervous system, we study about basically 2 components, sensory component and the motor component. So basically, ASIA scale does what? ASIA scale categorizes the patient according to their sensory preservation and motor preservations, or sensory dysfunction and motor dysfunctions. In category A, we saw that there is complete spinal cord injury at the level involving S4, S5 segments, where there is sensory and motor dysfunctions both. Then category B involves incomplete spinal cord injury patients. Incomplete spinal cord injury patients involved at the level of B involve sensory functions are preserved, that means sensory functions are intact, but motor dysfunctions are prevalent. In category C, there is again incomplete spinal cord injury, but here sensory and motor functions are both preserved. Sensory and motor, both components are preserved. But in this case, the key muscles, which will be the key muscles of the lower limb or the key muscles of the limb being studied, will have MMT or power or range within or below 3. Within or below 3. So we categorize scale C, or we give the category C to those patients in which there is incomplete spinal cord injury with sensory and motor preserved. Sensory and motor, both components are preserved. There is no as such dysfunction, but the key muscles MMT, if we do key muscles MMT, it reveals that the power is either 3 or below 3. Next, D is incomplete spinal cord injury, which causes sensory plus motor functions reserved. Sensory and motor functions are preserved as we saw in section C, but the key muscles in this section, in this category, the key muscles MMT will be more than 3. the key muscles MMT will be more than 3. It could be 4, it could be 5, it could be depending on various other factors. Basically, this category involves hemiparesis type of patients in which there is loss of power, but the power is not as low as we see in category C. Category E involves entirely normal individuals. Entirely normal individuals as in those individuals who do not have spinal cord injury. So, revising the diagnosis is based on two factors: the electrical activity factor, which is involved in nerve conduction velocity test, nerve conduction velocity test, and the second is the ASIA scale. ASIA scale stands for American Spinal Injury Association scale. Now, this ASIA scale is categorized into 5 parts as we discussed earlier. Since we have discussed the various levels of injuries, it is very important for us to know that how many types of spinal cord injuries are prevalent in practical aspect. When we talk about the conus medullaris syndrome occurs when there is compression or any trauma at the conus medullaris level. Conus medullaris level as in the level of T12 to L2. T12 stands for thoracic 12 vertebrae and L2 stands for lumbar second vertebrae. Any disease or any trauma occurring at this level may induce compression or tearing of the conus medullaris, which is generally termed as conus medullaris syndrome. This conus medullaris syndrome involves in dysfunction of the upper limb, lower limb type of motor neuron characteristics, which in general states that there will be lower limb weakness, there will be low back pain, as we study in T12 to L2 segments, and then there will be urinary retention as well. Bladder and bowel syndromes will be dysfunctionalized. Next, the sixth point will be cauda equina syndrome. Cauda equina syndrome is basically any injury or any damage to the cauda equina part of the spinal cord, which is the last part, which is termed as phylum, just above the phylum terminale. So, any injury at the cauda equina level, at the level of L2, L3, L4 will be termed as cauda equina syndrome. This cauda equina syndrome could be of two types differentiatively. One could be extramedullary and second will be intramedullary. If we see the extramedullary type of cauda equina syndrome, there will be sensory and motor loss more in the distal segment of the lower limb. Distal segment of the lower limb as in towards the ankle and foot more prominently. If we see towards the intramedullary segment, intramedullary type of cauda equina syndrome will have sensory and motor dysfunctions more at the proximal lower limb as compared to the distal lower limb. Now, after the completion of classification, we have studied that what are the general characteristics, what are the salient characteristics which are seen in various other types of spinal cord injuries, and we have also studied about the diagnosis which we will be making on the basis of ASIA scale rating. Now coming back to the assessment, the last part of the video lecture. This assessment concludes a very detailed physiotherapeutic assessment, which in general involves firstly collecting the demographic details of the patient. You should collect the demographic detail as in the name, age, sex, occupation, the address, phone number, blood group, various other informations which are considered prominent for any data collection. Next, we will be going on towards the chief complaint, what the patient complains to you, for what the patient has come for regarding physiotherapy treatment. Next, we will be heading on towards the history. History is a very important factor since the etiology of spinal cord injury could give you a brief discussion on what could be the possible types or what could be the possible characteristics of such patients. Next, after history and chief complaints, we will be coming on towards a detailed neurological assessment. This detailed neurological assessment will conclude basis on the observation, palpation, examination of higher mental functions, examination of the sensory system, examination of motor system, the reflex assessment, and then in general the ADL activities which the patient, ADL as in activities of daily living, which the patient is able to perform or is not able to perform. Thank you.